and welcome to yet another episode of HealthDNA. I am Nivedita Das. Cancer, a word which spreads only fear. What is the causes of this deadly disease? What makes it look really scary? Is it because of the less awareness, or it is the course of treatment? To answer such frequently asked questions, today I have with me Dr. Ang Pang Thiam, who is a cancer specialist at Parkway Cancer Centre, Singapore. Welcome, Doctor, to
Hello.
India TV Digital.
Thank you.
Firstly, I want to ask, what is cancer?
So cancer, in actual fact, we're referring to a cancer cell. As you know, the human body is made up of many cells. And these cells have a natural behavior. They will live, they will die, and new cells will replace them. And there's an orderly manner in which the cells should develop and die. But sometimes in that process, when the cells are recreating themselves, some mistakes happen, and these abnormal cells are formed. By and large, the body's immune system is supposed to be able to detect when these malformed cells are formed. The immune system is supposed to go in, detect it, and eradicate it. But unfortunately, from time to time, these abnormal cells escape detection, and then they have the ability to grow. They will start invading the neighboring structures. They have the ability to spread and attack other parts of the body. The example which I use is very simple. You have a classroom of students. You teach them all, study hard, be good people, become news reporters, be lawyers, doctors, policemen, do good in this society. But sometimes you have some students, despite the fact that you teach them what to do right, they go the wrong way. They become gangsters. They start off by just stealing a little bit of money here and there. Later, they start doing bigger and bigger crimes. And that's exactly what happens to the cancer cell. Some of them just cause a little bit of problem, but some of them have the ability to go around and cause trouble. And when it starts destroying parts of your body, then that's why it becomes such a dangerous cell. Okay. It can cause destruction of your lung, spread to the bones, affect the liver, and so on and so forth. So cancer basically is a naughty cell that has decided to go its own way and attack the neighboring structures and metastasize, spread to other organs and cause trouble.
So how do you deal with this naughty student?
Okay, so the correct thing to do obviously is number one, we must try to reduce the number of naughty students. Okay. So we know some of the causes of cancer. For example, we know that if you smoke, the smoke will destroy and affect the lining of the lungs. Don't take up smoking. If you're already a smoker, stop smoking. All right. So number one is in terms of prevention. Number two is in terms of early detection. If you're unfortunate enough to indeed develop cancer, what we as doctors hope to see is that we can detect it early. Because the earlier we can treat it, the better our chances of curing it. And the third aspect in terms of a cancer control program, number one is prevention, number two is early detection, and number three is treatment. All right, it is very important to have a robust medical system that can offer the best treatment in order to be able to achieve the best results in terms of cancer care.
We are talking about early detection.
Yes.
How early detection is the early detection?
Okay, very good question. So when you talk about early detection, we are talking about there are various aspects to it. Number one, we tell people, look, if you've got the symptoms, go and see a doctor. Now, what are these symptoms? It can be very simple. The symptoms could be a chronic cough that lasts for more than 2 weeks. You've got some blood in your sputum. Or when you wipe your bottom in the morning, you notice a little bit of blood. Or you examine and you say, hey, why is it I feel a lump in my neck or a lump in my breast? Okay, if you've got pain. So whenever you get any symptoms, especially if the symptom lasts for more than 2 weeks or has recurred, it is important to see a doctor. All right? Of course, there are also things we can do in terms of screening. There are some things which are proven, some things that are not so proven. What is proven, for example, is if you're a woman, from the age of 40, you should start going for your mammograms and ultrasound the breast. Because in many countries, breast cancer is on the rise.
On the rise.
And breast cancer can be detected when it's stage 0, in a pre-cancerous stage, or when it's stage 1, where your chances of cure are over 90%. Another form of screening. If you're a woman, once you become sexually active, you must consider doing a pap smear. So these are things that we can do. All right. For the men, what can you do? We know, for example, the colonoscopy. All right. Once every, some say 5 years, 7 years, 10 years, do a scope. You say, why? What does the scope do? We know that the polyp is like a little kind of a fleshy tissue that grows in the colon. It takes 7 to 10 years for a polyp to turn cancerous. So theoretically, if you do a scope once every 7 years and you pluck off all these benign polyps, then your chances of developing colorectal cancer will be significantly diminished, and it will help in the early detection of cancer. So there are things we can do in terms of detection.
This insight has given me a lot of scope for questions, and I'll come to you later for specifically talking about cancer in women. But to start with another question, what kind of cancers are you treating, especially from Indians who are visiting to your facility?
I come from Parkway Cancer Center, and we are based in Singapore. But the truth of it is we see a fairly large number of patients who come from India. For the Indian patients, I would say that the common cancers that we see, all right, cancer of the lung. Very sad to say. I think that the cigarette smoking rate in the incidence in India is still quite high. So we see a significant number of people who come to see us for advanced lung cancer. Another cancer that's very common among Indians is actually cancer of the head and neck. Partly because of cigarette smoke, partly because of betel nut or tobacco chewing. So we are seeing patients, many of these patients, and many of these patients present with very advanced disease. I'm sorry to say, 85% of patients who present with lung cancer present with stage 3 or stage 4 disease. In other words, the chances of cure of these patients is very, very low. For the women, we see a wide range. Breast cancer is very common in women. It's very common. Another cancer that's common is cervix cancer and ovarian cancer. That's why we think it's very important for women to be aware of their bodies.
So now that we are talking about prevention, so is it correct or is it wishful to say that the cancer, any kind of cancer, or especially other than the lung cancer, which is detected at the late stage of stage 3 or stage 4, other cancers can be treated? Or can there be any lifestyle changes which can, prevent you from getting cancerous?
Well, there are many things we can do. Prevention simply means that we adopt a lifestyle which lowers our chances of getting cancer. Unfortunately, we have not reached the stage when we can tell you by doing prevention, you will not get cancer. No, we can't say that. For example, we know that a cigarette smoker has a higher chance of getting lung cancer. But sad to say, there are people who don't smoke who still can get lung cancer. But you talk in terms of relative, smokers have a higher rate of getting cancer compared to non-smokers.
I would want to understand, like you said, that a smoker will get a lung cancer. It is high, there are high chances that a smoker will get a lung cancer. But we have seen a few cases in India here where a woman is getting a lung cancer. 2-3 things which the doctors have told is that the women above 40 is getting that lung cancer. That is 1 in, I think, a million cases, and a very rare. So is it possible that...
No, I won't say 1 in a million. Or 1 million is too low a percentage. It's much more than that. I can't give you an exact reading, but I would say that it will be in the single digit, meaning it will be less than 10%, but less than 10% of women who are non-smokers can get lung cancer. But there's a very interesting feature that we have noticed. Among the women who get lung cancer, who are non-smokers, 70% of them, 70% of them, it belongs to a very special category which contains a particular gene called EGFR. Okay? In other words, if you're a female, you've never smoked, you're Asian, and you're unlucky enough to get lung cancer, and we do a biopsy, there's a 70% chance that in your cancer, we will find this EGFR mutation. Now, why is it so important? Because for these patients with this EGFR mutation, even though the cancer has spread, okay, even though it's advanced stage, you may not need chemotherapy.
Okay.
You may be able to just pop a pill, a targeted agent, and with this targeted agent, you'll be able to control the cancer.
So when we are talking about women and cancer, three cancers which, if I am correct, which is very common in India and maybe other rest part of the world. One is the ovarian cancer, second is the cervical cancer, and third is the breast cancer that we are talking about. So now in India, across the world, we have got this vaccination for cervical cancer. Please tell us about it.
Okay, so what we do know is that a significant percentage of the women who get cervical cancer have been infected with the human papilloma virus. Okay, the good news is there's now a vaccine available. By taking this vaccination, we hope to be able to prevent women from getting this human papilloma virus, HPV. If we can lower the incidence of HPV infection in women, we predict that the incidence of cervical cancer will go down. So we recommend for all women, before you become sexually active. Now, when they start before you become sexually active, that becomes a society issue. In America, they say that the women, some of them, the young girls, become sexually active at the age of 12 or 13. So therefore, the recommendation is do the vaccination as early as 8, 9, 10 years old. But I think India, Singapore, we are slightly more conservative. So we just don't really fix the age, but we say that before the girls become sexually active, let's protect them by giving them the vaccination.
Normally, it is believed that if a woman has cancer, and it is highly genetic, that her daughter might also get cancer. Is it true?
Okay, all right. So I think to say that there's an increased risk of the daughter getting cancer, it is correct. But you say there's a high risk of the daughter getting cancer, that is not true. Okay? So it's a fact. If your father has cancer, your mother has cancer, then the likelihood the next generation someone will get cancer, the risk is increased. But it's not the high percentage that people conceive.
When we are talking about the cure of cancer, the first word which we get is chemotherapy. And also nowadays we are getting another new word which is called targeted chemotherapy. And there are we have also seen cases where people are not able to take the chemotherapy. Even after the first session of chemotherapy, people are not even able to go to the second session. So please talk about it. Please tell us about it, that how important or how difficult is it for a patient to take chemotherapy?
Okay, very good question. So let me try to correct a misconception. Chemotherapy is an important part in the fight against cancer, but really there are three strong pillars as far as cancer treatment goes. We must never forget that surgery continues to play a very important role in the treatment of cancer, especially if the cancer is an early stage cancer, especially if the cancer has not metastasized, has not spread to other organs. So let us not forget about the importance of surgery and the important role that surgeons play. Number two, radiotherapy plays an important role. There are many cancers which are very sensitive to radiotherapy. For example, there's no role for surgery if you have nasopharyngeal cancer, nose cancer. There's no role for surgery. All right? Radiotherapy is the cornerstone in terms of management of the disease. But both surgery and radiotherapy are what we call local modalities. They treat the problem where the problem is. Okay? For example, you have a breast cancer, the surgeon doesn't operate on your liver, he operates on your breast. If you have radiotherapy, if you have got a nasopharyngeal cancer, you have radiotherapy to the head and neck area. So these are called local modalities. But to be fair, the biggest advancement in cancer management comes not from local treatment, but from systemic treatment. In other words, treating the whole body. In other words, we are not talking about one particular area, we are talking about the whole body. And to treat the whole body, you will need some form of a drug treatment. And this drug can come in many forms. In breast cancer, we talk about popping hormonal tablets, all right, hormones in order to suppress the growth of the cancer cell. That is a form of cancer treatment, all right. Number two, we are talking about cytotoxic chemotherapy. In other words, these are drugs that cyto-cell, toxicity, kill. These are drugs that have the ability to kill the cancer cells. And obviously, when you're killing cancer cells, you can, in the process, kill normal cells as well. So that's where you're talking about the significant side effects that's associated with cytotoxic chemotherapy. Now, so you can see there are many types of systemic treatment, many types of drug treatment.
So this compels me to think two things. First is that if there are so many ways of cancer treatment, then why, my first question is that why there are so many cases of relapses first? And second, while taking chemotherapy, is it likely, or is it there are chances that other organs are also getting affected?
Okay, so it boils down to several factors. Okay, it boils down, number one, to how early the cancer was diagnosed. Okay. So if your cancer is diagnosed at stage 1, the likelihood, 90% confidence in most cancers, you're going to be cured.
Okay, there won't be relapse.
There won't be relapse. Okay? So that's why I say early detection is so important. If you're diagnosed stage 2, well, you get the best possible treatment, your chances of cancer relapse is 25%.
Okay.
There's a 75% chance you're going to be cured. If you're diagnosed with stage 3 cancer, all right, it means your cancer is already spread to lymph nodes and so on. The likelihood that there's going to be microscopic disease that is hiding in the body, the load of microscopic cells is going to be higher. Maybe now your cure rate has dropped to 50%. 50% chance of cure, 50% chance of relapse. But now we go one step further. At the time the person was diagnosed, the cancer had already metastasized to the lung or the liver. By golly, your chances of cure are negligible. In some situations, when it's isolated, you may still have a 25% chance. But if it's spread to several organs, you have a 0% chance. Okay, so again, toxicity is something whereby every doctor must keep in mind. Okay, it's very important. All right. The most important question to ask when you want to administer any drug is, what is the objective? What is your objective? If your objective is to cure the patient, then you must be prepared to accept a certain degree of toxicity. If your objective is to control the disease, kill the cancer cells, shrink the tumor, prolong life, preserve quality of life, you must be very careful in terms of toxicity. There is no point in telling someone, I have controlled the cancer very well, but the patient has to lie in bed 24 hours a day, 7 days a week. That is not good practice. So you must be able to know who are those that you say, look, I'm sorry, the bigger goal is to cure you, even if there is some toxicity, we are prepared to accept it. Versus a situation where, look, I'm not going to cure you, much as I want to prolong your life, control your disease, preserve your quality of life, preserving quality of life is just as important. So that's why it's so important to know your patient and to understand for the patient to understand what you're trying to achieve and to have a goal which is realistic.
So the last question, doctor, please give us at least 3 such practices which a common man should adopt to be, at least if not cancer free, at least to keep this deadly disease away as much as it can.
Okay, 3 pieces of advice. 3 pieces of advice. Number 1, all right, the importance of prevention. It's very important. In terms of prevention, you have heard it time and time again, oh, don't smoke, avoid too much fatty food, Exercise regularly. Obesity has been associated increased risk of cancer. So try and keep trim, exercise, Live a healthy lifestyle. Don't stress yourself. We don't know how much this contributes to someone actually getting cancer, but whatever may be the possible causes, let us try to reduce the risk factors. That's component number one. Number two, if we can, go for early detection. Go for early detection. All right. Whether it's in the sense of seeing a doctor when you've got symptoms, or whether you're talking about breast examination, whatever is available in terms of whatever is affordable for the individual, keep that in mind. Okay, that's number two. Number three, you must have the fighting spirit if at the end of the day you're found to have cancer. All right. If you start off and you say, look, cancer is a death sentence, then woe betide. There's nothing else to do. But if you believe that indeed there are options, seek an opinion from a doctor. And don't stop at one. That's always good to get a few opinions to make sure that truly whatever you are going through is the right treatment. Optimize your chances of beating the disease. That's what I would tell everyone. The three pillars stay the same: prevention, early detection, and treatment.
So like you heard the doctor, lead a healthy life. If you find any kind of discomfort, do visit your doctor, and let's not lose our hope, because cancer is curable. Thank you, doctor, for your time, and thank you for giving such valuable inputs to India TV Digital.
Thank you very much for inviting me.
Thank you.
you.